Alright, hi guys, John Moreno here again, spine rehab specialist, here to talk to you today about bilateral lower extremity rehabilitation and how we here at Spine Rehab Specialists can help you out with that. So again, bilateral lower extremity rehab, what does that mean necessarily? Okay, so bilateral lower extremities just means your legs, so both of your legs. So we can injure our legs in many various ways, whether it be sports, whether it be a car accident, maybe you were born in such a way that your legs just kind of weren't as fully functional as they could be, as some other people's legs are. So again, there's just many things, many reasons, or maybe you develop something, so many reasons for your legs to not work as well as maybe they could be, as they once should have, or they could be in the future. So in order to help with that, we do therapy. So that's what we do here at Spine Rehab. We do a lot of physical therapy, and we use a lot of various tools, but one of the tools I want to talk to you today about is the AlterG. So AlterG, or Anti-Gravity Treadmill. And so in this sense, be anti-gravity meaning less gravity, without gravity, as opposed to against gravity. And so what this treadmill does, it's like a standard treadmill, except it has like a giant space bubble around it. So what we'll do is we'll put you in some specialized shorts so you can get into the machine, get hooked up to the machine and all that. And then once you're in there, then we turn the mechanism on. What the mechanism does is it just pumps a lot of air into the machine, into the area of the space bubble while you're on the treadmill. And then that helps with reducing the amount of pressure you're putting on through your legs. It can also reduce a little bit off the spine as well. So why is that important? Well, because the less pressure you're putting through your legs, the more likely you are to be able to move it and move it effectively. So we're trying to put our full weight. Right now I'm walking because I don't have an injury, I feel fine. But if I were to injure my hip or my knee or my ankle, I'd probably be walking with a little bit of a limp, because it'd be really hard to put all my weight on it because it's in pain. So what the AlterG does is we can take up to 80% of your body weight off. Doesn't necessarily have to be a full 80% body weight off. So that's the other cool thing about it. We can adjust how much weight we can take off or put back on. But we have the capability to take up to 80% of your body weight off, so we can start you at a very light level of putting pressure through your leg, get you used to doing that and doing that correctly, and then start progressing you to 30%, 40%, all the way back to 100%. And then we can still use it at 100% just for the sake of helping you with your fear of falling, because again, you're in this giant mechanism, this giant device, and so even if you wanted to try and fall, you really couldn't, because it would hold you up. So again, another neat aspect of the AlterG, because you can start retraining to getting back into shape, whether again you had a musculoskeletal injury or maybe you have a neurological injury, and so obviously in those cases even more of a greater risk of falling. But with the AlterG, you minimize that risk, and therefore you don't really have to worry about falling, so that's great. And so you can put in your full effort, and you don't really have to get worried about getting tired, because again, even if you happen to slip up, fall because you're tired or whatever the case may be, the machine will catch you and support you, and you'll still be okay. All right, so again, I was talking about the AlterG. So this is the AlterG. So this is where the action happens. So I'm going to have my student Dina demonstrate how exactly you guys would be using this machine. So again, we put on some special shorts. If you want to look over there, put on some special shorts. And so Dina, go ahead and come over here. There are various sizes for various people. So where we get on is we step onto this gray mat right there, and then we go and step into the circle, into the middle. This is where we'll lift it up, then we'll lock it in place, then we're going to zip you up, or zip you in. Some shorts have loops for forwards, which is the main one we use, and then sideways. If we want to do some side walking, really work on your gluteus medius muscles and all that good stuff, then we could definitely change to that direction. So now we're zipped in, then we'll go and start it up. So Dina, you're gonna keep your feet flat on the treadmill, and then you're also gonna have your arms crossed around your chest. All right, now it's gonna fill up with air. You're gonna feel like it's gonna lift you up onto your tiptoes. So try and resist that feeling. I want you to keep your feet flat on the treadmill at all times, okay? So it'll start to fill up with the air, and again, that air is going to help reduce the amount of pressure you're putting through your legs, and again, a little bit through your back, depending on how high we put this thing. So mainly want it around here. Again, mainly it's to help out with the hips, the knees, the ankles. Again, if we want to get that extra space for the back, then we'll just lift it up a little bit higher. So again, you're in there while it fills up. perfectly calm, perfectly fine. Then once it calibrates is when we can actually start getting to move and all that. Alright, so now that it's calibrated, we can start. And then you can go ahead and relax your arms, Dina. You can grab onto this if you'd like. So again, here we're messing with the body weight percentage. Again, not everybody needs to start off at that 20% body weight, so I'm just going to have Dina start at 75%, since again, nothing's really wrong with her, but just for the sake of demonstration, we'll start up at 75%. So we can also have a live video feed of how your feet are and how you're walking. I'm going to turn on the speed now, okay? You'll be walking. So again, we can raise it up in 0.1 mile an hour increments, which again, convenient. Again, people might have not walked in quite a while, depending on whatever's gone on with them. So we can adjust it very slowly, very lightly. Is this very slow for you though?
Yeah.
All right, so we can kick it up for Dina a little bit. And we can see how she's walking. And then if she had any abnormalities, then we can then work on that, correct it, make sure she's walking correctly with that proper heel strike pattern, heel to toe, and then make sure she's walking properly at this weight bearing percentage. This assumes she just progressed to this. And then again from here, once she's got that down, then we can start raising the amount of pressure you're putting through your body. So now 80%. So now her muscles and everything else are working a little bit harder, so we can again build up that muscle strength, so help stabilize whatever area we're working on. So again, not only can we do walking, but we can progress to jogging, running, for those of you who want to get back to doing that. And we can do various other exercises. So we'd bring the speed back down. We can do squats, we can do calf raises. So Dina, go ahead and try and do some squats while you're in here. So she can squat down, she can do calf raises, go ahead and try to do some calf raises. And do lunges, like so. So there's lots of other exercises we can come up with and do for you. And again, we'll tailor based on what's going on with you and how you're feeling and what we need to work on. So again, very versatile machine that we can use to help you out, help you get better and back to where you need to be. All right, guys, thank you again. So that's basically what I talked to you about today. Just letting you guys know that we have that here at Spine and Rehab Specialists at both our locations. So we can definitely help you out with getting you back up to running, walking, whatever other activity you may want to be doing, just that's affecting your life in the sense of you not being able to put weight through your legs. So again, if you've been having issues, just call us, let us know, and we'll help you out to the best of our ability, and we'll see if the AlterG is an appropriate tool that we can use with you, amongst everything else that we do. All right, guys, thank you very much for your time. See you later.